Hi, I'm Scott Markham. I'm one of the physicians here at Murphy Medical Center in Harlan. I've been asked to talk to you about some of the more pressing and concerning questions around the community, and so here I am. You know, at Murphy, it's still kind of business as usual, but it looks different. We're trying to prevent our own staff exposure as well as the spread of the virus, so we'll all be wearing masks and goggles with all patient interaction. Not that any of us are infected, but that's just the standard at this point. We believe that this is predominantly contact with droplets, and so the key is to wash your hands just often as you can. So with every patient, we're doing the hand hygiene in and out of every interaction with patients. We even actually wash our gloves after we touch a patient. So it looks different, but it's just a way that we can prevent spreading the virus should it be around. We are still seeing our well childs, our OBs. We are still seeing, some strep. We're seeing still some flu, some mono. That's the problem with COVID-19. Not everything is COVID-19. So some of these patients still need to be seen. So if you're really sick, don't hesitate to come into the clinic and see us. We'll put a mask on you as soon as you arrive. Put your hands in your pockets, don't touch anything, and we'll bring you back and evaluate you. But our hospital is preparing for, the onset of a lot of sick elderly folks, and we do have a plan in place for an overwhelming number of patients that might require oxygen support, might require ventilation. We're going to do our best to take care of everybody, and we're ramping up in anticipation of that. But we're making a lot of preparations for when this gets ramped up and we see more sick patients, but we're still, at this point, still business as usual. We haven't seen a whole lot of positive COVIDs in Shelby County, but the published symptoms are predominantly cough and fever. There are those that really actually have absolutely no symptoms and can be carriers of the virus, and that's why we're advocating this mitigation or social distancing, because not everybody is going to have a cough. Not everybody's going to be febrile. The predominant symptoms that everybody talks about is the fever and cough. It can start with some congestion and a scratchy throat. They describe the cough as more of a dry cough as opposed to that wet, hacky stuff. Some people, even younger people, tend to have more GI stuff at the start of it. But, so it's that variability of symptoms that makes it more difficult to diagnose. But at the same time, we just say if you're not terribly sick, just stay home. Like I said before, we think it's 90+% contact with droplets. So, everybody's, the masks are great, but really what the masks do is keep you from touching your face. It's not that the aerosolized virus is, all that contagious. In fact, some of the studies suggest that to contract the disease from aerosolized stuff, you have to be exposed for a fairly long period of time because the viral load isn't terribly heavy in that aerosolized environment, but in the droplet it is. So hand washing and hand hygiene and not touching your face is the key. But a lot of this is, goes to, when you go shopping and stuff. If you're going to the grocery store, go on purpose and be very deliberate. Don't dink around and shop and go for what you need. Do not touch your face after you pick up an item. Do not, your hands are contaminated. As soon as you touch anything, your hands are contaminated. You have to assume that. And so then you get your groceries, you go home, you unpack them. Do not touch your face. Wash your hands. You can actually wash your vegetables and your fruits and things like that. You can wipe down the boxes and all that kind of stuff with antiseptic things, but you have to assume that everything's infected because it is a big deal. Really, it doesn't make any difference. You just have to assume that your environment is contaminated no matter where you go, even when you come here. So you just take all those precautions. And the big precautions are really hand hygiene and don't touch your face. The masks are a good reminder that you don't touch your face. And that's really what they do more than block the aerosolization. The testing is probably the most frustrating part of this whole pandemic. Ideally, it'd be fun to or be interesting to test everybody, just to know who's got it, who doesn't, as opposed to just assuming that you've got the symptoms, go quarantine yourself for 2 weeks. But the reality is the testing kits just aren't available. And so at this point, we're fairly limited in what the Iowa Department of Public Health really wants us to do for testing. People over 60 with comorbidities, people who've been exposed to a known COVID positive patient, and healthcare providers and people who live and work in communal areas like nursing homes and that kind of thing. These are the people that we absolutely have to know whether or not they're COVID positive. The vast majority of patients that come in have a cough and fever, and they're otherwise well, and they're not one of these essential employees that has to go to work. The Iowa Department of Public Health does not want us testing these people as of yet. As soon as testing kits become more available, I'm sure we'll ramp up and do more testing, but right now it's fairly limited. The bottom line is, if you're not terribly sick, a positive test doesn't mean anything because we don't change our treatment. It's just kind of the reality. My daughter-in-law is an essential employee down at Vanderbilt Hospital. She's going to work, doing the same thing. She has to wear a mask with every patient interaction. Hand hygiene's just emphasized. My son has to go to work. The same thing. It's just stay 6 feet away from everybody. Don't touch your face, and hand hygiene. That's a real concern. This virus is supposedly able to live on a lot of different surfaces for hours to days. I think as healthcare providers and those people that work here in our environment, those essential employees that work anywhere, the hand hygiene and just not getting sick. But then when you go home, what I do is I walk straight into the laundry room and take my scrubs off, and I don't let my wife anywhere near my shoes or my dogs. Then shower, and I think that's reasonable. Maybe it's overkill, but I think that's reasonable, and I think it's okay. Yeah, there is a lot of anxiety about this virus, and everyone, including healthcare professionals and our families, and it's that big unknown. Right now, this mitigation is working. I think if people will do their best to socially distance themselves, respect that mitigation because it is working. I can't emphasize enough, hand hygiene and don't touch your face. I mean, that makes me feel better. That will really curb the mortality rate with this disease. I can't allay the fears. Some people get bad sick, some people don't, but the vast majority of people don't get terribly ill, won't require oxygen, won't require intubation. If you just adhere to the hand hygiene and you don't touch your face, hopefully you'll never get sick. If we do this mitigation right, it's going to help. And hopefully we'll get through this.